Hi, my name's Ashley. I'm going to be your nurse today.
Hi.
Can you tell me your name and your date of birth?
Yeah, Amanda Moore, 8/15/91.
Okay, and I'm just going to take a look at your wristband. Okay, perfect. I'm just going to wash my hands real quick and then raise your bed, and we're going to do a set of vitals. The vitals all seem normal. Are you having any pain today?
No.
Okay. All right. So patient is lying in high fowler's position, legs extended. Smile on her face, looks happy, healthy. Hair looks great, smooth, clean, no breakage. I'm just going to take a look at your hands, and nails look great, no breakage there, not brittle, so nutritional status looks good so far. So could you just tell me what today's, I'm just going to ask you a few questions. So what's today's date?
November 20th,
Okay, and what's the day of the week?
Wednesday,
All right, and where are you?
MCHP.
Okay. So patient is alert and oriented ×3. What could you tell me, how do you describe your ethnicity?
Caucasian.
Okay, perfect. So ethnicity matches what patient describes. And speech is so far articulate, no slurring, sounds good. I'm just going to do a little skin exam. So if I could take your hand, and we're going to test for hydration, and how we do that is if it's called the Turgor test, and we'll pinch your skin. If there's tenting, then that means that there would be signs of dehydration. But you're good, and we'll do that bilaterally. So skin looks good, no signs of jaundice, no signs of cyanosis, so skin color looks good. Temperature is nice and warm. I'm going to take your hand again. No excessive moisture, doesn't seem diaphoretic, not too dry and not clammy. So neuro, so we'll go ahead, your eyes are, you're blinking spontaneously, so that's good. So I'm going to do just a little upper and lower body strengths on you. So if you could go ahead and squeeze my fingers, all right, good tight grip there, and then go ahead and hold your hands out, and then push down on my hands, okay, and then push up on my hands. All right, good. All right, so I'm going to do just a little, I'm going to check your pupils. So if you could go ahead and look at the back of the room for me. Okay, good. So I'm going to have you look at my finger, and then look at the back wall. Look at my finger and look at the back wall, and then just follow my finger with your eyes. All right, so pupils are 3 millimeters. They're round, symmetrical, and they are reactant to light, and there doesn't seem to be any facial drooping, so face is symmetrical. Could you go ahead and swallow for me? Okay, so good there. All right. We also have to do your lower body strength. So I'll have you push up on my hands, good, and then push down on my hands. All right, perfect. So good, I'd say grade of 5 on upper body strength and lower body strength, so very good. So I'm going to do just it's a dull and sharp test. So I'm going to use my chapstick. If I could just grab your hand. So this is going to be dull, and this is going to be sharp. So if you could close your eyes and then just tell me which one it is.
Dull. Sharp.
All right, perfect. Okay, I think we're gonna move on to respiratory. So, trying to think if I missed anything with neuro. Cool. Okay, so we're going to move on to respiratory. So I'm going to have you, take a deep breath and then cough. Okay, good. When you cough, does anything come up, any sputum or no? And if there was any sputum, then I would assess for the color of it, and I would assess for the consistency of it. All right. So I'm going to check your lung sounds. Also, there doesn't seem to be any trouble breathing. You have no nasal flaring. There doesn't seem to be any retraction going on in the abdomen. Are you able to lay down without any assistance of pillows? Like you're able to lay down comfortably and be able to breathe?
Yep.
Okay, so no signs of orthopnea. And then are you able to walk up and down the stairs without any trouble, without trouble breathing? Okay, so there would be no DOE. All right, so I'm going to take a listen to your lungs. So we would start with the right upper lobe and then the left upper lobe. And then we would do the right middle lobe and the right lower lobe and then the left lower lobe. Okay, so lungs sound clear. There's doesn't seem to be any irregularities there. Okay, so cardiovascular. So I'm going to take a listen again to just the apex of your heart to see if how that sounds, see if we can hear anything abnormal. Okay, perfect. So now I'm going to listen to the apex of your heart, and I'm going to check your radial pulse at the same time. Okay, good. So there's no pulse deficit. So there's no pulse deficit. And I'm going to just check your heart sound. So one more time with the stethoscope. So we will start at the aortic with the second intercostal space, and then we'll do pulmonic with the second left intercostal space. Over here is the second right intercostal space, and this is the second left intercostal space. Then Erb's point is the third intercostal mid-sternal border, and then tricuspid is the fourth intercostal mid-sternal border, and then mitral is the fifth intercostal space. Okay, and if I heard any irregularities with that, then I would use the bell of my stethoscope to listen a little bit closer, but no irregularities, so we're good. I'm just going to take your finger for a second. So we're going to do a cap refill, and what we'll do is just press down on the fingernail, and then let go, and then you should see the color come back in about 1 to 2 seconds. And then you do the same thing for the toes. So shoes would be off, socks would be off, and I would be checking for cap refill in the toe. And same thing, if the color should come back about 1 to 2 seconds. And then while I'm down here, I would check for edema. So you would just press down on the skin for 5 seconds and then let go. And if there was any pitting, then you'd have a positive edema, and then you could grade that as well. So I'm going to do I'm going to palpate all of your pulse sites. So we're going to start with your temporal and your carotid, and then we are going to do your brachial and your radial and your ulnar and femoral, and then we would do popliteal here, and then we would do posterior tibia here, and then the top of your foot is dorsalis medius. All right. Well, I also have to do a range of motion. So what that is I'm going to just place my hand on you, and then I'm just going to assist you, but you're going to do the full range of motion. So you're going to move your arm for me. So I'm going to put my hand on your shoulder, and then I'm just going to have you push your arm out towards me. Okay, perfect. And then pull your arm up to the ceiling. Perfect. All right. So, any pain with that? Okay. And there was no crepitus, so no pain, no crepitus. And then I'm going to do the same thing with your legs. So I'm going to put my hand on your hip, and then I'm going to have you pull your leg out towards me. Perfect. And then up. Okay, perfect. And then we're going to flex your knee. All right, good. So no signs of crepitus with that. Good upper and body, good upper and lower body movements and strength. No signs of crepitus, no pain.
Nope.
Okay. All right. So. All right. And how is your bowel movements been lately? Good. Yeah. So they're not irregular. They're normal for you.
Normal for me,
And
yeah.
how many times a day? How many times?
Once.
Okay. And diet, how are you tolerating your current diet? Good. Okay, eating normal,
Yep.
normal eating habits. All right, so I'm just going to take a look in your mouth. So if you could just open up. Okay, so mouth, oral mucosa looks good, pink, moist, and intact. I don't see any lesions or anything to be worried about in there. I'm just gonna have you stick out your tongue. And tongue looks midline, moist, and pink, so that all looks good as well. And then how about your teeth? Are they real? No
Yep.
dentures?
Yep.
Okay, perfect. So teeth are Patience owns her teeth. All right, and so contour is flat, so that looks good and healthy. And then I'm just gonna listen to your vowel sounds. So we're going to listen to your lower right quadrant, and then we'll do your upper right quadrant, and then your left upper quadrant, and your left lower quadrant. And one other thing with the going back to respiratory, I'm just going to take a quick listen to your posterior lungs, okay?
Yeah.
All right, so we would do the upper right lobe for that, and then the left upper lobe, and then your right lower lobe, and your left lower lobe. Sorry about that, I just had to jump back there. All right, so we were on, so all of your, you have all positive vowel sounds in there. I don't hear anything abnormal. So if I did, then I would wait 5 minutes and then go back and recheck again. So now I'm just going to palpate your quadrants. So we will do your right lower quadrant, your right upper quadrant, your left upper quadrant, and your left lower quadrant. And There's no I don't feel anything, superficial going on there, so it's all normal there. How about any hemorrhoids? Are you having any hemorrhoids lately that you know of? Okay. And urine, are you able to urinate okay?
Yep.
And when was the last time that you urinated?
A few hours ago.
Okay. And when you urinate, there's no trouble starting, stopping, there's no dribbling?
Nope.
Any pain with urination?
Nope.
Okay. And when you urinate, do you see, what color is it?
Pale yellow.
Okay. So that's a good color. And then there's no cloudiness. Do you have any cloudiness to your urine?
Nope.
Okay. All right. And so, have you noticed any lesions down there at all? No. So no open, no soreness, no lesions. Okay. Okay. Well, I think that's all. Those are all my questions. So thank you for your time.
Thank you.
And the call bell's right to your side.
Thank you.
All right, you were a great patient.
Thanks.
All right, and I'm gonna put the bed back down, and I will go and document everything.